Welcome to Coping Together, Mental Health Association of Central Florida's live web series dedicated to helping you develop coping strategies and wellness tools related to COVID-19, as well as talk about mental health. Coping Together was created in response to COVID-19's mandatory social distancing orders. This show seeks to learn and educate. We do not speak for any particular group. Overall, Coping Together serves as a platform through which we can demystify and unpack mental health concepts and hear from experts in the field. Please note that this show may discuss sensitive topics including but not limited to sexual assault, suicide, and various traumas. If you find yourself feeling upset or struggling during any episode, listen to your body and pause the input. We will post related resources. Remember, it's okay to get help.
Hi, everybody. Welcome back to this week's episode of Coping Together. I'm your host, Faith, with the Mental Health Association of Central Florida. Here, as always, to talk with you about topics related to mental health, COVID-19, and just how we're all getting through this journey together. I'm very excited to welcome a guest that you've all seen before, Claudia Swonger, who is the Director of Behavioral Health Community Outreach for Osceola Regional Medical Center. That is a bit of a mouthful, so I'm sorry if I got that wrong. But how are you doing, Claudia?
I'm wonderful. How about yourself, Faith?
I'm good. Thank you very much. And so today we're here to all of you talking with Claudia, who I think is a great person to talk to you about this, mental health in the workplace during COVID-19. So we talk all the time here about mental health. We've talked about it being in the home. We've talked about you being remote, but really talking about work, whether you're at work right now or you're working remotely still, or you've had to transition or do a phase, whatever it is. That's kind of what we're here to talk about. So I guess before we delve in, the first question I want to ask you, Claudia, is how is one's mental health related to their workplace and the work that they do? How do the two tie together?
Well, it's important to keep in mind that the American culture, we spend more time at work than we do at home. And now we are at home working. So now everything is just mixed together right now. So in order for us to be more productive, to have better performance, and just to have that mental balance, it's important to recognize our own mental health when it comes to during this time of COVID. So that's why mental health in the workplace is so important right now, because it affects so many areas of our lives and now the workplace.
That's a really good point. So it's not just that it affects it. It's not just that it affects it now. It's always affected it. But now it's almost like the two have collided and it's harder to find that balance. So you have to work a little bit harder to do that.
Yeah. So everything in the workplace has changed. Work as we know it has changed in so many ways. If we're working from home, if we're working on site, with COVID, there's been so many changes. There's a lot of great studies out there. Actually, Microsoft did a study in July, and they published it in a Harvard Business Review. And they studied about 350 of their employees, and they found that people feel that they're working 10% more than they did before, working remotely and on site as well. People are working longer hours. They're working through their lunch breaks. They're not taking any breaks. Their work life and their personal life, like we talked about, are now combined because they're at home. So there isn't okay, I'm ending my day at 5 and I'm getting in my car and I'm driving home. No, you're already home. So the commute is a 2-minute when you close your laptop. So everything about the workplace has changed. People feel that they're working harder. They're more stressed, especially now with everything being virtual. People feel that now they have to pay more attention to the other person's nonverbal, or be more mindful of your own nonverbal as well. And before, we had breaks in between meetings to walk from one conference room to the other. Now it's a Zoom call ends at 2 and then another one starts at 2. So just a lot has changed regarding just work in general during COVID.
I think you make a good point. And, kind of adding to that, there's, in addition to just not having that commute again, not being able to watch in the conference room, you're also missing out on that the conversation by the water cooler, or, going to make copies and kind of getting up to get a break from your desk. I know for me, working from home, if I didn't have my dog, I probably wouldn't move for 8 hours straight.
Yeah.
So I can only imagine that for a lot of people, and I think that if I may add to that, some people feel almost like that extra bit of guilt, like they want to make sure that they're doing a good job, showing they're doing a good job working from home, because it's not the same as when your boss could just walk up and see that you're doing your job and see that you're doing well. And so maybe people feel that added pressure. Do you think that's part of it?
Absolutely. That, and then of course, like you mentioned, you are at home with your dog. Some people are home alone. So there's still the isolation piece that a lot of people are still experiencing. So that adds perhaps more to their already pre-existing mental health challenges. So depression, more anxiety, the constant worry, the constant fear. So that adds more to someone's mental wellness.
That, and if anybody has kids and they're dealing with whether it's virtual school or their kid is back at school.
Yes.
I know plenty of families who had to make a decision as to whether or not they're going to send their kids back or not. And now either they're balancing working from school and having their child working in the same room.
Yes.
Or they're having to, worry about how their child is doing at school and hoping that their child is safe and healthy. So yes. I can only imagine that it sounds like it's a lot, basically, for anybody who's working right now, whatever your situation is, it's a lot.
It is a lot of stressors. Like you said, parents are now wearing a lot of hats. They're wearing a teacher hat, a classmate hat, parent, their own hats pertaining to their workplace. So it's a lot on everybody's plate right now. So that adds another factor to how the workplace has changed. Now, like you said, you're sharing a desk with your child who's on an iPad learning or on their own school laptop. So it's a lot. It is.
And I think that's a really good kind of transition into my next question for you, because with that, there is, like I said, there's not your boss walking by to check in on you and see how you're doing. There's not an office for you to go to when you are feeling overwhelmed, and be like, hey, I need a minute or whatever it is. I used to love going to my boss in her office and just being like, okay, I need to talk to you. And there's not that outlet as much anymore. And so with that being said, for those of us who work for someone or work for a company, if we are working remotely or if we are working in this new normal, how can we effectively advocate for ourselves and for our mental health in this kind of situation?
Yeah, very important. So the good news with COVID is that it is affecting the way we view mental health. I'm a true believer that it will destigmatize, or it's starting to destigmatize more mental health. So employers are aware. There was another study that showed that 85% of employers are somewhat or very concerned about their employees' mental health. So it is starting to be a topic of conversation now. And what employers are doing is that they're adding more, they're addressing this, and they're offering more resources for employees. So some of the things that they're offering is a flexibility and a work-life balance. So perhaps some of them have more flexible work schedules, or they're reduced work hours. They are now providing more resources regarding EAP, which stands for Employee Assistance Program. It is a benefit that a lot or most of employers have that a lot of people aren't aware. These are free counseling services. So I encourage everybody to ask their HR or their supervisor for more information on that. Facilities, a lot of facilities are offering now gyms or workout rooms or a meditation room. Enhanced compensation, they're adding more behavioral health benefits, they're adding more breaks, perhaps added pay or bonus pay, and just other initiatives regarding mental health. But I think the first step is just starting the conversation. It's just talking about it. And it is more normal than we think. 1 out of 4 adults have some type of mental health challenge that they're going through. And especially in healthcare workers, it's actually 2 out of 5 have some type of mental health.
That's before COVID, those statistics, or is that post-COVID?
That was pre-COVID. Yes, that was pre-COVID. Now, I don't have any updated statistics, but the 2 out of 5 with healthcare workers are with COVID.
Yeah, and we may even end up seeing those numbers increase, or that ratio kind of increase. Would you say? Obviously we can't speak to that right now, but
right. Mm-hmm. Yes, because those numbers should be changing because we're still seeing the effects of March 11 shutdowns. And then just everything else that's coming soon regarding like the evictions and everything else due to unemployment. So we're going to see some changes, but something else too is leaders just be more mindful and more aware of what's going on with their employees. And of course, this is seen, unfortunately, negatively, job performance and productivity, engagement in one's work, communication with coworkers, physical capability and daily functions. So if leaders are seeing perhaps an isolation from their employees or just a change in behavior, or that one coworker that was always so chatty and always so friendly and positive, you notice that they're quiet or more isolated. It's just a simple question. How are you today? What can I do to help you? It just opens a conversation, and you'll be surprised. A lot of people will answer honestly because they do need the resources and the help at this time.
I think that's a really good point that, and we talk about this a lot in Coping Together, varying on the topics, but a lot of times I think people are afraid. They don't know, I don't know how to help. I don't know what to do, like maybe I'll just leave it alone and they'll be okay. But really, it sounds like a lot of people appreciate whether or not they're going to say it, but a lot of people do appreciate, I think, that being asked. It shows that you care. It shows that it's noticeable, this change in you, so that, you're not alone in this. I think it takes away from that a little bit. So that's a really good point. Thank you.
Mm-hmm. Absolutely. And people also think that if you bring a topic up, then there is that stigma of not talking about mental health. But like I mentioned, I think this will definitely help destigmatize mental health, because it is a topic right now that everybody can relate to, because for the first time in history, everybody in some shape or form has been affected by COVID. So if anything, just start a conversation.
Yeah, no, thank you for that. And so that kind of leads me into my next question, and we've kind of touched on it, but so many of us have had to transition to working remotely because of COVID. So my question, I guess, is like, how has some people's mental health changed since working remotely? Mm-hmm. And also, I guess, what are some of the ways in which mental health could be negatively impacted working from home? And like I said, you've kind of touched on this, but is there anything more you have to add on that?
Sure. So for those who had already had some challenges with related to their mental health, just be mindful of if this is perhaps just triggering more. Reach out to those resources, reach out for help. Like I mentioned, there's EAP, there's a lot of free resources out there. You guys are a wealth of information that people can reach out to. NAMI has great groups and great resources as well. There's virtual resources. Now they're starting with in-person resources as well. So just know that you're not alone, that it's okay to not be okay during this time. And just try to set those boundaries. Again, if you're at home and you're working, it's important to just set those boundaries when it comes to start time, end time, kind of knowing when this is part of your personal life and when it's work related. There's a lot of little things that people can do to still practice self-care, even if they're working remotely, getting up and walking around the house, walking around outside of the house, going outside and connecting with nature, setting reminders on your smartwatch or on your Alexa to get up and maybe do some stretches in your chair, reaching out to those people that are part of your support system, setting that time aside on weekends to practice self-care or after work. Boundaries are just very, very important right now if you're working remotely, if you're working on site. Again, it's important to set those boundaries there as well, and kind of recognizing when you're not being productive and when you're not okay. Because again, now more than ever, we can all relate to just everything that's going on. So you're not alone.
That's actually a really good point I kind of wanted to add about, or just kind of acknowledge. I know a couple of people who are in this kind of phased or partial, return to the office. And I've noticed with it, it's a lot of times like one person alone in the office. And I think that was just kind of one thing I wanted to touch on or ask you about as well. And, kind of that person who has to take turns, and they're not, they used to be surrounded by people. That's my dog on the floor, by the way. I'm so sorry if you can hear her throwing her bone around. But there are so many people, or they used to have so many people in the office, and now it's just one person. It's been described to me before as kind of being in a dark room, kind of feeling a bit like you're in like this post-apocalyptic world. Do you have any advice for those people, what they can do if they're in the office to try to be a bit more comfortable?
Absolutely. So again, technology now, we can do so much. I would definitely say maybe a work buddy and be in communication via text or even via Zoom. Talk to your supervisor, talk to a leader, and see if there's other ways to kind of change that environment. If it could be maybe if you can work from home some days or be on site some other days. I would maybe even change your office or your environment a little bit, make it a little happy, maybe do like some redecorating or just some changes.
Like a window, if you have a window in the office.
Absolutely, a window or buy a picture of a window. I've seen those now as well. Yeah, there's a window and then there's a landscape, and maybe it's not the real thing, but it's still something. Add some brightness to the room. So I would definitely say just acknowledge that and talk to your leaders and see what maybe some changes can be made, and then just be in contact with your coworkers via text, via email. And have that buddy, that person that you can reach out to when you're just not doing okay on certain days.
I think that was a really great thing you added as well, that, it's not, it doesn't have to be every day that you're not doing okay for it to be important. Like you said, it's on, any day, whether it's one or a few or several or every day. It's every single one of those has validity in how you're feeling. I don't think with COVID, or really with mental health in general, it's a question of like, is it enough for it to be bothering you? Of course, there's a question of, is it, to the point where it's significantly impairing you? But regardless, it's still, you're allowed to have a bad day. You're allowed to have a day that, where you struggle, and no one can tell you, oh, it's not that bad. Because like you said, we've all been impacted by this, and none of us, I think, have ever experienced anything like this before.
Right. So we are all on our own personal journey. And I think the biggest takeaway is just be kind to yourself and be patient. This is not easy. So one day at a time is my motto. Just take it one day at a time, because it's a journey. It's a journey that we're all in. And what may work for you may not work for me. And that's okay, because we're all different. So it's important for all of us just to find what works for us, what work environment works for us, what family environment works for us, and just keep working at that, on searching that, on finding that balance.
That seems like a really good motto to live by, and I think a really great way to kind of end the episode, which is, like you said, just take it one day at a time. Everyone has their own pace, their own, like you said, it's our own journey. So there is no judgment in how you get through that if you have a couple hard days or several hard days.
Yeah.
So with that being said, thank you again so much, Claudia, for being here. It's always a pleasure to bring you back.
Thank you.
Thank you all to you at home or at work for watching us. It's always a pleasure getting to talk with you and share this information. If you have any ideas about topics you want to see us discuss, please reach out to us at the Mental Health Association, or if you feel like you might need any resources, anything at all, please reach out to us. We can get you connected with different options. Like Claudia said, there are so many that exist that are here for you. And so with that, I will let you all go back to your day, and I will see you next time. Thank you.